What questions or problems are you working to solve?
I am working on making sure that world-class medical expertise and medical information is available at the fingertip of billions of people worldwide. Uh, in other ways, if I were to put it, it's trying to build a world-class AI doctor and put it into the pocket of billions of people worldwide. So the process of making medical expertise, like democratizing access to it and making it available to billions of people worldwide, it's actually an immensely challenging problem. So the kind of AI systems that might be able to provide safe and grounded medical advice, the kind of things that we need to be able to do over here, it includes a lot of fundamental advances in machine learning and AI that we still need to be able to do today. For example, the ability to interpret multimodal medical data, spanning, for example, health records, medical images, clinical language, lab tests, and increasingly new modalities of data such as genomics. It also requires the ability to be able to engage in conversations with the end user, who could be, the person that you're giving to care to, or maybe it could be the provider as well. It also requires the ability to, ground your information that you're providing or the answers that you are generating in verifiable and authoritative sources, follow clinical guidelines and best practices and beyond. It also requires AI systems to be able to, respect privacy, which is such a paramount concern in healthcare. And last but not least, safety is most important over here. In many ways, healthcare moves at the speed of trust. So for us, it's very, very important that we are not only doing like capability demonstrations and cherry picking outputs from these systems, but actually running proper validated studies and demonstrating the reliability of these systems and showing that they, 99.999% of the time are doing what they are supposed to be doing. And that is how we are going to be able to build confidence in these systems and ensure that everyone can adopt and use it safely and reliably and get the most benefit from it. And in the flip side of trying to build out this system that can function potentially as an AI doctor, and by no means this is imminent. This will take a lot of time, a lot of research, a lot of thinking, and also a lot of things that we need to deal with on the policy and regulation side. But the approach of getting over there, which we broadly like to call sending AI models to medical school, I think what we are hoping to get out of it is, in the flip side, we are going to not only end up with like a system that can function as an AI physician, but can also be a very good world-class AI scientist that can help us, further our understanding of human biology, better understand it as a trajectory in an n-dimensional space. It can tell us what would happen, for example, when we intervene with like specific therapies and therapeutics, and help us really scale personalized medicine to everyone. So my grand hope with all the progress in LLMs and AI and that has been happening and that is going to continue to happen in an exponential manner is that we are going to end up having these systems that are going to play this role of a world-class AI physician scientist. And so that is in turn just going to help us scale up personalized medicine to billions of people worldwide.
Why have you chosen to pursue this question or problem?
So the reason I've been working on this is it has been something that I have cared about for a long period of time. So I grew up in India, and in some of the nearby towns and villages that I was growing up in, for many people, going to see a doctor was almost close to impossible. It often meant walking 20, 30, 40 miles in extreme heat, going without like food or giving up on a day's wages. And so I knew people who had not seen a doctor in their entire lifetimes. And this really, really bothered me. And so in many ways, even while I was doing my undergraduate degree, I always wanted to do something about this. And so back in the day when I was doing my undergraduate degree, and it's almost a decade back right now, I was working on this app called Ask the Doctor Anytime, Anywhere. And so the name is very, very descriptive, but it clearly tells you what we are trying to build. It's basically a system where you can enter, the questions that you have or the kind of medical information that you're looking, say symptoms or whatever that you're having, and then you get like a differential diagnosis or medical expertise. But unfortunately, back then, the ML technology that we were using, the machine learning technology that we were using to bootstrap the system, was not quite ready yet. But I'm very, very pleased to say that the arc of progress in artificial intelligence, AI, and especially large language models in the last few years It allows us to dream of that future again, where world-class medical expertise or a world-class AI doctor is available, at the fingertip of billions of people worldwide. And so, yeah, I mean, so that is what I'm building towards, and I'm immensely glad and excited to say that this no longer feels like science fiction anymore. This feels imminently possible.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
So, building artificial intelligence systems for applications in medicine or biology or in scientific discovery, this is an intensely multidisciplinary endeavor. And so it cannot be done by, say, people with AI expertise or ML engineers or researchers in vacuum, but it requires, people with medical grounding and medical training. So the team that I work in, the projects that I've been working on at Google, we have a world-class team of clinicians who we work with in lockstep to, all the way from problem formulation to the metrics that we are using to, measure measure the capabilities of the models that we are building, uh, the measures that we are putting around them, and then how we optimize them, as well as what are the endpoints or the products that we are building to, surface these models in the real world and translate them into real world applications and clinical workflows. So in many ways, I think given that the technology that is really coming into fruition at this point of time right now, it is so immensely capable. But at the same time, there's a great need for responsibility over here, and it requires society as a whole to come together. So that is not just like AI researchers or engineers, but people with medical training, people with medical expertise, doctors, clinicians, or anyone who might be end users of these technologies, patients, or even like non-expert everyday lay users, but as well as people such as those who have background in privacy and ethics and regulation and policy. So really, all of us need to come together to ensure that this technology with such immense capability is translated into a manner so that everyone can benefit from it. And so, yeah, I mean, that is, I think, the problem maybe we as a society need to grapple with. But I am very, very positive that we can do that. And yeah, and that would just generally mean that the future is immensely exciting for us over here.